Hello, everybody. This is just a little short presentation just on the Dutch eating behaviour questionnaire. Now, why am I doing this? It's because I've worked a lot in weight loss over the years, and lots of students that have been on my courses have asked for me to provide this scale so you can understand it. Now, when you're working in weight loss, if you're trying to work on weight loss yourself, this tool is really useful. It's one of the best things I've ever come across in my years of seeing patients. And it's called the Dutch Eating Behaviour Questionnaire. Now, why is it so useful? It's because sometimes when we're talking to patients or trying to understand your own relationship with food, it can be really useful to understand what drives people to overeat. So we use it a lot in obesity care. I'm trying to help people with overeating. So the first section looks at a restraint scale. So some people actually undereat, and then that leads them then to overeating. So we call that restraint eating. And this is a restraint scale. So what we would ideally do with this form is print it out and give it to the patient or fill it out yourself without judgment. Don't second guess the answers and don't think about it too long. Just go with the answer that feels most relevant to you in that moment. So the sort of things that we're looking for in this first section is, do you try to eat less at meal times than you would like to eat? Do you deliberately eat foods that are diet food, so slimming foods, which can be really problematic? And are you constantly thinking about weight loss, and are you constantly thinking about undereating? So we know, as we said, that undereating tends to lead to overeating. So if you can think about trying to help someone from a weight loss point of view, you can't really help someone if you don't understand potentially what their cause or their drivers are to overeat. If you understand their drivers to overeat, then actually you've got a really good chance of helping them. The second section here is the external eating scale. These are people who are driven to overeat via external stimuluses, which means that when they're out and about and they smell a delicious bakery, they can't bear to pass a cake shop because the smell, of course, they leave the doors open, is oozing forward to them, and then that leads them to overeating. So, when you're preparing a meal, are you inclined to pick and start eating then? And if food smells good, do you eat more than usual? So that means that your drivers are more of external factors. Useful to know when you're trying to put a treatment protocol together. And then we've got the really important section, which is emotional eating. Now, lots of people eat emotionally from external cues that are emotionally driven. So, there's lots of work been done in this area whereby individuals have a greater desire to eat when they're irritated, for example. So, if they're angry, they eat. If they're sad, they eat. If they're upset, they eat. So usually emotionally driven. So do you have a desire to eat when you're frightened? So classically, a stress response would lead us to a reduced appetite. But if that's not the case for you, then that's useful to know so that you can try and have the appropriate treatment outcome. And then do you have the desire to eat when you're bored or restless? So this scale gives us an indication of how to interpret that, but also what to do about it. And having the desire to eat when you're cross. So feeling angry, you eat. Do you celebrate with food? Do you commiserate with food? And this scale can help to identify kind of some of those drivers. So we've got 3 key sections. I'd urge you to have a go and play around with it. I use it a lot in my teaching arena, but also with patients who are struggling with their relationship with food. So I hope this has been helpful for you. And please feel free to download the form. You'll find it on our website at Botanical Pharmacy UK and hopefully attached here on the Instagram page. Thank you.